Thank the mayor for joining us and making this a priority of his administration. There are two moral imperatives why we must reauthorize the Zadroga bill. All the first responders, more than 30,000 responders and survivors, are sick and in need of special care today. We know, unfortunately, that thousands more will get sick, that will get cancers caused by 9/11. There are two moral imperatives why we must help them. One, because they're Americans. And because New York wasn't attacked, the United States was attacked. It is an imperative duty of the federal government, in Lincoln's words, to care for him who shall have borne the battle, unquote. And these 30,000 first responders and survivors, people who lived and worked down here, and the responders who worked on the pile, they are victims of an attack on the United States, and it is up to the United States to support them and to help them as we would the wounded in the armed forces in any war. That's the first moral imperative. The second moral imperative is that it was the deceit by the federal government, by the EPA, that came out and said, when we knew it wasn't true, that the air was safe to breathe, go back to work, go back to school, work on the pile without any special protection, that caused many of these people to get sick. There is a moral obligation, because had it not been for the deceit by the federal government at the time, many of these people would have had proper protection, or they wouldn't have returned to work, or they wouldn't have gone to school, and the first responders would have worked with proper respirators and so forth. And this was especially true after the first couple of weeks. The first couple of weeks, there was a rescue operation. Maybe someone is still there alive. After that, it was a cleanup. There was no rush for the cleanup to risk people's lives, but people's lives were risked because they were told by the federal government that there was no problem and no environmental contamination, when we knew perfectly well there was. So the second moral obligation is that we must seek to heal those who are sick because of the federal government. We passed this legislation after an epic struggle in 2010 in what Kirsten or Carolyn, I forget who, referenced as the Christmas miracle, the last minute passed in the House and the Senate. It was a long struggle. I hope it will not be a long struggle again. The people who are now getting treated must continue to get treated. The people who have not yet been diagnosed but will be diagnosed must not be left hanging because it's a few years. We cannot allow it to be said that in 13 years, that's how long we remembered 9/11. We set up a museum, we gave lip service to it, but we forgot the victims in 13 years. We cannot allow that to be said. It would be a moral stain on this generation and on the United States. That's why we must reauthorize this legislation. And that's why I'm glad all the people who are here, all the union leaders, all the city administration leaders, and Senator Gillibrand and others are going to work with all of us to fulfill our moral obligation and pass this legislation.